Good evening, everybody. Tonight, I'm very excited to be interviewing Emily Powers-Smith. Emily is the only sexologist in Ireland. And for the people who don't know, sexology is somebody who would help couples and single individuals as well in every sex issues they have. Emily has been doing this for a very long time. She has been running her own practice for over 10 years. She has been involved in teaching and education, and she does provide psychosexual therapy, coaching, and psychosexual education in her practice, in the media, as I said, in the education field. And she's very, very, very passionate about what she does and very enthusiastic. And what she wants to do, she wants to get all women in Ireland talking about everything sexual and educate them in the right way. Would that be pretty right, Emily?
That's pretty good. You got it. You
Okay.
got it down. Yeah, pretty much.
And the reason why I wanted to interview Emily was that one of the problems that we encounter a lot in menopause treatment is low libido. And my concern is that we are worrying too much about over medicating women in menopause. And sometimes women come in to me because they want a fast fix, a quick fix. They want a tablet of a hormone that will fix all their problems. And they forget that sex is much more complicated than that. And I hope that this chat with Emily tonight will enlighten everybody on the issue. So my first question to you, Emily, is libido. This is the most common complaint in menopause. If somebody has low libido, where should they start?
Well, I think it's fascinating, and thank you so much for having me, Rita. I'm such a fan of you and your how you work with people, and that women can come to you and talk openly about sexuality with you, because that's not everyone's experience with all practitioners. So I really appreciate that, and so I work probably from the other end of things than you work in a way, because I don't prescribe and I don't examine. So I'm looking at all the other things except for HRT, that people can do for their libido, with the caveat that I would always say, if there is pain, if there is discomfort, if there is you're not getting any help with your hormones, I would always recommend that a woman goes to somebody like you who specializes, just to check that they're on track, that everything is working well. Because if there's pain, you're not going to get past that. You can't talk your way out of pain. You've got to get the treatment that's needed. So just to say that bit.
And I think that's really important. Thanks for pointing that out, because the first thing I always say to women is you have to get your house in order. You have to get your vagina in order. If the vagina is not working, forget about the rest.
And your vulva, because I think as well, for women, some women who are getting helped with topical estrogens, for example, or pessaries, they may also be experiencing discomfort or a change in their vulva tissue. So in the
Yeah.
clitoris, in the area around the clitoris, their labia, and all that external area is the vulva. So vulva is like our face, and the vagina is like the mouth. And so all of this area gets affected by low estrogen as well. So if you're using pessaries, it isn't always guaranteed that that's going to help with the external, and you might need a little extra help with that as well. We have to make sure all of the house and the garden are in good order. The lady garden, that's an expression we use, yeah. So that's really, really important. But then we have to also remember that women are not animatrons. We're not robots. We can't just switch on and switch off. We can't expect ourselves to have good libido if we're absolutely exhausted, if we're not very happy, if we're on medication that affects our libido. No amount of other help is going to fix that until we know about that and know what we can do about the medications we're on. We have to check about our fitness levels, if we've got any chronic illness or pain. We've got to check about body image and our sexual repertoire. Is it very limited? Is it the same? Is it routine? Women get really bored, and if everything is the same all the time. And yet some women I work with would feel they're the reason that they do the same thing all the time, because they might have some sexual shame. They might have issues with their body image. They might not feel that they have the confidence to communicate with their partners about what they need, or they might actually know what they need. And all of those things can lower libido. And most of us going through menopause, I'm one of them, we have more than one of those things. If our partner if we're using a male arousal model, as the female arousal model, we're going to have expectations of ourselves that aren't realistic or fair. Then we might feel like we're failing or like there's nothing we can do about it, when actually it's like comparing oranges and apples.
Tell us a
So,
bit
another,
about that. Tell us about the
yeah,
arousal, because that's one thing that I try to explain to patients, and usually people don't understand. So just tell us a bit more about that.
so I split. I talk about good sexual encounters. I split it into three, just for simplicity's sake, and they overlap a bit. But I separate them out into pleasure, arousal, and stimulation to orgasm. And I think we need all of those as women to be able to look forward to being sexual. And I think a lot of us in our busy lives, we rush to stimulate. Sorry, I'm drinking the we rush to stimulation to orgasm because we're in a hurry. And I think of it like food. It's kind of like having fast food sex. It's kind of like McDonald's. And I'm a fan of McDonald's now and again, but I also like to sit and feast. I like to take my time. I like to enjoy the cutlery, the way the table is set, and I like to enjoy the different types of food and drinks you can have and the chat. So that's the pleasure part, and that's also for a lot of us women, it's what we need for our arousal. So women need a lot longer to become aroused than men do, and women who are menopausal and women in long-term relationships, we often need to actually decide we want to get turned on and then take action. But because we have a male model, we think we should wait until we're horny before we do anything. But then we never do anything because we rarely get that urge. Men get an urge differently to women in that respect. I am generalizing, it's not the same for everyone. But that is part of it. Also, because we're not taught about that, we're taught that the vagina is our sexual organ when in actual fact it's the birth canal, and we're not taught anything about the clitoris. We don't know about our clitorises. So we don't know that that's what a clitoris looks like, and that's what a clitoris. That's what we have to work with. If we know anything, we focus on this little glans here, and that is like 6 times more sensitive than a penis. And so, again, if our male partners don't know about this and we don't know about it, we'll often get too much stimulation too quickly and go past pleasure and into pain before we've built any arousal. This is made of erectile tissue, just like a penis. And so we get erections, but they take time to get because we can't get a mouth or a hand around anything but this little area here. But in order for all of this to fill with blood and get really big and plump, and then these arms wrap around the vaginal canal, which is about here, it takes time. It can be very quick for a man to get an erection depending on his age, and menopausal women are often with men of that similar age, so there's all that we're not talking about today, but generally we need to know that we need longer, and that's just the way we work. There's no failure, there's nothing unusual or weird about us. This takes time, and it can take up to 40 minutes of really enjoyable, useful stimulation to get a full erection. That it can do. It certainly takes a lot longer than a couple of minutes, which we often think is all we have, or often all that we'll give ourselves. So I think that's really important. I also think, and just the one other thing I want to say, I think for women as well, a lot of our arousal is easier to reach if we're getting non sexual foreplay. I call it foreplay for foreplay. So that's where we feel interesting, we feel noticed, we feel heard, we feel funny, we feel sexy, we feel flirted with, we feel noticed by our partners or whoever. And that's non sexual stuff. So maybe at the start of relationships when we were younger, a slap on the bum and get spun around and a big, strong kiss and a grab of our
Anything will
boobs.
work.
Maybe that did it, but as we're older, that really often doesn't work. We need to know that we're more than that to our person. And women, we need our heads we need to be turned on in the brain as much as anywhere else, which is why a pill, that's why they can't find a Viagra for women.
Hmm. And I
There
think
isn't
that's really important what you said. So two things that I think are excellent is exactly the problem I have. The women expect for me to give them a hormone or a tablet that would make them switch on automatically and they go off and do the sex possibly as quickly as possible.
one.
And that's not
Yeah,
going to happen. And the other thing that you said that I think I really would like women to reflect on is the fact that, as you say, women do need more. And I think sometimes women do, but they're just afraid to ask. Would you agree with that?
absolutely. but also because we don't know that it's okay to, we don't know that we should ask. We think we should be working like men are.
Yes.
It's lack of education. It's nobody's fault. Nobody's educated about this. Nobody's taught about the clitoris because, as you know, as better than I do, this is the only organ in any body that's only for pleasure. It does nothing else. So they can't slip in any education about it because we pee through it like they can with the penis. So we mustn't talk about pleasure. Mustn't, a
Mustn't
terrifying
talk. Yeah.
subject for educators.
Yeah.
So this is never talked about. So of course we don't know that it's okay to take longer and to ask for longer and to ask for all the other kinds of turn-ons that we need because we've only got a male model for it.
And women should not be afraid to say that. Women are afraid to say, look, that doesn't work for me anymore, and they think, oh, it must be me, it's me, so I need to be fixed, I need a tablet to fix myself. While in actual fact, if they communicate this desire to the partner and say that just doesn't actually work anymore, things would be much better, isn't it?
I think you and I we were talking about this before, that this idea that women don't know what to ask for, but also they feel bad for asking, because, and I think a lot of that is because we are taught in our culture to protect the male ego. So we'd rather have uncomfortable, painful, or unenjoyable sex than tell our person what they need to know about us because we're afraid we'll hurt their feelings. But the research shows that heterosexual men would much prefer to know what to do and get it right if they're putting the effort in. If they're not putting the effort in anyway, they're probably not going to want to
Probably
know
not.
anyway.
Yeah.
But those men who are engaged and interested in asking would much prefer you to tell them the truth than to plumose them or tell them, yeah, oh, it's fine, as they rub the clitoris off you.
Yeah.
It's just not,
Yeah.
it's just, and the other thing, I think you said this to me the other day, and it's something I say to my clients a lot, is when women come to me and they say, oh, there's something wrong with me. I don't want sex. And I'm like, well, do you enjoy sex? And they're like, no. I'm like, well, so you're a really normal, healthy person then. I mean, why would you want something that you don't enjoy?
Yeah.
That's nothing wrong with you or broken. We just have to work on it so that you enjoy it
Mm.
if you want to. And by the way, if you don't want to keep having sex, that's okay as well.
Yeah,
Like we
absolutely.
have, there's so much pressure on us,
There's
isn't there?
loads of
To
pressure. And as you
know we,
rightly said, it is important for women to understand that the right partner, if you're in the relationship, is delighted for you to have good sex. So if you teach them what to do, they're just going to be happy. They want you to make you happy. So it's just about.
well, I think that's lovely, but I think it's what can be way more complicated than that because in Ireland, we have so much sexual shame, and that's not just for women. So male partners can also really struggle to communicate, to hear, to even say what they like. I mean, I see that a lot as well with men. It goes the other way, that men don't want to hurt the female person's feelings. And in same-sex couples, it happens as well. So it's really, really interesting. But I think even if you want to have great sex and want to please your partner, there's layers to it. It can be complicated, and there can be blocks in the way of the best meaning people. Do you know?
Yeah.
Yeah.
And can I ask you what happens when you work with couple? Because when I do refer patients to you, and sometimes people are really afraid to take that step. What
Yeah.
happens when I say to a patient, go and talk to Emily, and they're lucky enough to get to see you, because obviously that's not that easy either nowadays, and so that women know what to expect. What would you tell them to expect?
So they'll contact me through my website, and I'll always respond pretty quickly. I'll be really clear as to what the wait is and what's going to happen in regards to. Um, so then the first session, anyway, when you finally get to see me, because you're right, I do have a waiting list all the time. The first session is just a get to know you session. So there's no pressure for anybody to have decided that, right, this is for me and I'm going to really engage with this. First, come and meet me. Unfortunately, since COVID, well, during COVID, I went online completely, and now I remain online at the moment. I hope to go back to in person when I can find myself a premises, but for now, it's online. So the first session is just to see who I am, have a chat with me, tell me what's going on for you. I'll tell you if I know about that and what I know about it, and and we just go really gently. The first thing I'll say to people is, I do this for a living. I think, write, and talk about sex all the time, and I don't expect the person who sits opposite me to be able to do that. I expect people to feel a little bit nervous and a little bit self conscious and worried about. So we go at your pace, not at mine. And you always have the option to say, hang on a minute, that's too much. I'm not ready to talk about that. So it's really, I learn all of that from the person sitting opposite me as to what their comfort levels are. And we figure out together what the issue is. And that might be different to what the person comes with. Because as you say, a lot of women will come and say, I'm broken. I need to sort our sex life. My partner doesn't even know I'm coming to you, or they know and they want me to just get fixed and then I'll go back and sex will be great. So there may be a little bit of chat around the reality of that, so that people's expectations are fair and kind to themselves. And then we decide together towards the end of the session whether we want to work together or not.
And tell me about the
Um,
partner. If the partner doesn't want to be involved, you said about women coming and the partner not knowing. Is that possible?
in my experience, no, not really. It depends very much on the person and the couple and what the issue is. But certainly in my experience, it works an awful lot better if the partner can get involved at some stage. That doesn't mean they have to go to couples therapy or sex therapy together. But if a woman comes to me and say she's trying to rediscover her libido and his is fine, then might invite him to join us for a couple of sessions so that I can educate him in what he needs to do to help her with her building of her libido, to educate him in skills, to teach him about female arousal, the same as I teach women. And I'm talking about heterosexual couples here, but this goes for same-sex couples as well. It goes for any people. In fact, it doesn't even have to just be male and female, but we're talking about menopausal women tonight. So, I think you don't have to think that you're both going to have to enter therapy. It can go either way. Either you come in as a couple or the partner can get invited in as needed. It's a lot easier for a partner to be educated by me than by their person who's coming to therapy, only hearing what they can possibly take in and remember and what's important to them. And that mightn't quite be what the partner needs to hear. So it's more useful if they come to me together. Nothing is secret or anything, and they come together, and I do a few sessions with the partner to get them up to speed, to get their skills up to speed, to get them knowledgeable about their person's body and arousal and how it works and what to expect.
And that brings me to my next question, which is, do you think there is such a thing as good sex and bad sex?
Sure, absolutely, but I wouldn't be able to say what it is other than I was thinking about this, and I was thinking, I'm sex positive, and that's really, really important to me in my work. But all that means is that all I worry about and all that matters is, are you safe? Are you fully consenting? And I want to come back to consent. And are you having fun and pleasure? So if you're having all of those things, that to me is the best arena to have the best sex. You can still have really boring sex within that. You don't have to have great sex every time. We all have meh sex. We all have meh orgasms. We all have self-love sessions sometimes. That's because we're human and we're organic and we can't be the same all the time. But generally speaking, those are the things. And otherwise, then after that, it's down to your personal taste and what you enjoy. And that, one man's debauchery is another person's heaven. And well, maybe heaven and debauchery are quite similar for a lot of people, but it can really vary. Yeah.
Yeah. And I suppose maybe the other thing I want to ask you is about expectation, because you mentioned that before,
Yeah.
and I think women have this idea that I have to live to certain expectation, maybe because that's what they see in the movies, and that's what they think
Oh
they should
yeah.
have. And what would you tell about women who are worried about that?
Well, look, I think we are all, I do this for a living and I'm affected by it. We are drenched in messages the whole time about what we should be and how we're not quite there. So if we buy this product, we will be there, and all that nonsense. But we're inundated with it. So it's really hard to not take on some of that So I think that in my experience, the best way to balance it is to really be educated. So you can go, oh, that's nonsense, or oh, that's a nice ad, or oh, that's a cute film, but it's actually not reality. So I don't have to expect myself to meet those standards or that image of, this thing, this, I mean, honestly, rom-coms and romantic movies keep me really busy. Those and porn keep me really busy when it comes to expectations, because they are just so full of nonsense. This thing I hear women say to me, more so women than anyone else, saying to me, if he loved me, he would know how to. If he really cared, if he really loved me, he'd know how to please me. It's like, have you seen your vulva? Compare that to a penis. How is he meant to just know this stuff? He's not
Yeah.
educated any better than you.
Mm.
So I think there's that. And then body image. We have a lot of really ridiculous expectations of our bodies from media and movies and fashion and all of that. And what I say to people is, try and just shift the focus a little bit from the aesthetics of your body to what your body can do for you. How much pleasure can you experience through your body? Because usually we can find something to be grateful for about our bodies then, and start there. It's a skill, it's a muscle we need to work out, this self-love, this self-acceptance muscle. So start small. Start with the color nail varnish you've chosen, if that's what you love, but you don't like anything else about your hands or your body. Give yourself some credit for what you chose to put on your nails and work from there. Find your starting point and practice complimenting, practice building your confidence about yourself. And that seems to me to be much more useful than looking in the mirror and going, oh, I don't have a washboard stomach. I've had children. And oh, my bottom is sagging. Well, yeah, of course it is. That's what happens at this age. But how much fun can you have with your body? That's a great question.
Yeah. If you can laugh about it, yeah, of course. Okay,
And I
I
think another thing about movies and stuff is we expect sex to be very serious and very clean and very quiet and very, when in actual fact, sex is squelchy, it's noisy, you fall over, you bang heads, you leak, you dribble, you make noises, sometimes you fart. That's what sex is about. And so you were just saying it, that's why I thought of it, laughing, being able to remember that we're doing this for fun.
yes,
For
it should be
fun,
fun. It's not another job on the list.
which is what a lot of women feel,
Yeah,
because they don't know how
yeah.
to have fun, because maybe they've never known, or maybe it's just never been available to them.
No. And
But yeah,
sometimes it's the
fun.
simple things. I always ask women, what time do you have sex? When do you have sex? Are your children in the house? Because these are all things that women worry about. And
Great
I'm
questions. Yeah.
amazed by the amount of women that don't have a lock on the door. So
Yeah.
I, I have two locks on my door, I tell all my patients. And there is a hardware shop because one
You must
wouldn't
have
know.
some kids who really want to get into your room.
Well, and funny enough, my husband is not usually great at a housework, but he was able to put those two up very very quickly. And there is a little hardware shop down the road from the clinic. And sometimes I send women with a piece of paper and said, that's where you go next. You go and buy the lock front of the man, which actually owes me some percent of his earning, and get the lock. Because simple things that people don't realize are important. And if you're afraid to be interrupted, and of course, like you're not even there with your head.
But I think yes, I think that's brilliant. But then you have to go, because my job then is to peel it back a step. Why are you so worried that someone's going to walk in? And then you get into this expectation that our children shouldn't know we're having sex. We must
Oh yeah.
hide that we're having sex. I'm like, well, how did that work out for you? Like, in the research globally would show that children who are brought up where sex is normalized in their home, and they know their parents love each other with their bodies and have sex, tend to not need to see people like me nearly as much.
Oh, that's interesting. Hmm.
Yeah,
So we do
if
them
you
a
can
favor.
normalize, it's pleasure, right? It's what adults do when they're playing together on their own in the room. Children very young can understand. How would you feel if I came and joined your game without your permission, without being asked, when you're just playing a game that just takes two people, and you can explain it in an age appropriate
Hmm.
way for children. But often I think Irish or Christian, maybe, or maybe religious people, or maybe, I don't know, but people who people worry that they shouldn't let their children know they're having sex,
And I
and
think
I
they're more
think
worried about the
why
grown up.
they don't lock their doors.
I think they're more worried about the teenager children, the grown up, than the small ones. I don't think the small one is much of a problem. I think it's the teenager that I'm more worried about usually.
I think they worry about all ages. The people I see that who worry would worry about. I have people who worry about fully adult children who are having their own sex lives,
Mm-hmm.
knowing that their parents are having sex. Yeah, so it's and then I have people as well who worry about their pets watching them.
Oh,
There's a lot of
you're well.
worry. There's a lot
Okay.
of worry. I think it's I think there's a lot of anxiety, isn't there? Just
Yeah.
generally, I with
Yeah.
COVID and war and global warming, all these we've a collective anxiety, and then we've a lot of people who have other anxiety as well. If you're anxious, you're going to have anxious sex. Of course you are. You can't switch it off for sex. So again, managing expectations is really useful. If you can just really think about, who am I? I'm a knackered, exhausted woman going through menopause with maybe an ailing parent and kids who still need help. And, I'm worried about stuff. Well, yeah, well, be kind to yourself. That's
Yes.
gonna dent your libido.
Because the testosterone is not going to fix that either.
No,
No.
no, exactly. Yeah. So I think kindness to oneself is really, really important as well. And I think we can be very hard on ourselves and expect an awful lot of ourselves. I think grieving as well as, people who are hitting menopause, we're hitting an age where parents are starting to die, or people, it's so there's all sorts of really big things that can be happening to us around this age and as we get older from that age, that they affect us, and they're meant to affect us. We're not meant to be able to have the same libido all the time through our lives. That's just not how we're built. So again, kindness and
Good.
self-acceptance.
Emily, thank you so much. I really enjoyed chatting to you. I have the feeling this is not be the last time we do this. I have the feeling that we will have questions and maybe have to invite you again if that's okay. But I think the
Absolutely.
take home message is really think globally about sex. Don't think about me giving you something that will fix it for you. And you're not going to fix it that quickly either, but there are solutions for there. So thanks very much. I really enjoyed talking to you, and I will forward questions to you, but I have the feeling they will be talking again.
It was lovely chatting to you, Rita. Thank you so much.